Today I'm going to talk to you about the 5 common causes of low back pain in CrossFit athletes, weightlifters and cyclists. I'm also going to talk to you about the management and when to go to physiotherapy. Hi, my name is Adrien Danhauser and I am a sports physiotherapist in Pretoria East. Let's quickly go through the anatomy, then you'll have a better idea on where the pain originates. So if you look at the lumbar spine, there's 5 lumbar vertebrae. In between the vertebrae, you have your intervertebral discs. On the side, where the top vertebra meets the lower vertebra, there's a little facet joint that connects the two. On the side, you also get your spinal nerves. Then you get your sacrum. And where the sacrum meets the hip, your hip will sit over here, you get your SIJ joint. That is your sacroiliac joint that sits over there. Now that you have a clearer understanding of where all the structures is, let's go into the causes of back pain. The first cause of low back pain is when you strain your muscle or when you sprain your ligament. Now the ligaments and the muscles inserts into this little bones here. So you have little ligaments and you have muscles that comes in here. So when you overstretch these muscles or ligaments, it can actually tear and that can cause the pain. Movements like bending forward, twisting your back, picking something up that's heavy that you're not used to, can all cause a muscle or a ligament to sprain or to strain. When an injury happens suddenly, it can cause severe pain. When it happens, I want you to rest for the first 48 hours, put some ice on the area, brace it off by either using a soft back brace or use strapping. After 48 hours, you can take some anti-inflammatory medication and you can give your physiotherapist a call. During physiotherapy, your physio will help to promote the healing by doing some soft tissue treatment techniques, spinal mobilization, dry needling and strapping. The second cause of low back pain is because of the disc. Now there's 2 things that can go wrong with the disc. The first is when the disc degenerates by normal wear and tear. That is when the tough outer layer of the disc dehydrates and becomes stiff. So that actually the disc is too big, so it causes a hamburger effect where the hamburger patty is too big for the bun. So what happens is when you go and do a CrossFit movement like picking up a heavy object, when you bend forward to do your deadlift, that flexion position can actually cause the disc to bulge more to the one side. When it bulges out to the one side, it can compress on the nerve and that can give you low back pain. The second thing that can happen is when the disc actually herniates or when it slips. What happens is the jelly-like center of the disc starts to ooze out on the side, and the fluid that comes out is filled with proteins which can cause inflammation on the nerve. So this normally is associated with very severe pain. It can also give you referred pain down the leg that goes where pins and needles and numbness are associated with. So my advice when you get a disc injury is to find your physio. Physiotherapy can help immensely for the disc patient, especially when you have a disc bulge. The physio will help to try and get that disc, to reduce that disc back into the middle by either doing exercises or spinal mobilization techniques. When you have a herniated disc, we recommend, actually the literature shows that physiotherapy can help, but it does take a long time. It can take up to a year to get better. But if you experience weakness down your leg or when you have numbness or decrease in sensation, we would suggest that you phone your orthopedic surgeon immediately. The third cause of low back pain is the facet joint. The facet joint is a joint that has the same properties like your shoulder has and your ankle. So what is interesting is it's the synovial joint, and it's richly innervated with the nerves and capsule. So you can imagine if you sit in front of your computer for 8 hours, now you get to the CrossFit box and you go and do kettlebell swing, when you go into this extension pattern and you're not used to that, you can actually sprain your facet joint. So what happens is this facet joint becomes really stiff, and it can give you quite a sharp pain with standing movements or running or walking. So what we would recommend, you come to your physio. What we do is we work a lot on the spine, we mobilize this little joint and also the surrounding muscles to get your mobility back. The fourth cause of low back pain is sacroiliac dysfunction or lumbar-pelvic dysfunction. So this occurs normally at your SIJ joint. The SIJ joint is a low motion joint that helps to absorb shock. So there's not a lot of movement going on here, but you can get a lot of inflammation in this area and that can give you a lot of pain. Now, lumbar-pelvic dysfunction is quite a complex injury to have. So normally it's associated with muscle imbalance and stiff muscles. So what we would recommend, if you get pain down your buttock, in your back, on the side of the hip, is to go and consult your physiotherapist. Your physio will do an in-depth evaluation of your sacroiliac joint, of your hip, of your lumbar spine, as well as look at your core and how your muscles work together. So the physio will help to sort out those muscle imbalances and also sort out the muscle stiffness. The fifth cause of lumbar pain or low back pain is your nerve root pain. So that is when something compresses on the nerve root. Now this can happen either here where the nerve comes out of the spinal column, or it can happen along the nerve root when it goes down the leg. Your nerve root pain is normally with your cyclist. When they have a disc bulge, it can compress on the nerve root. So you must remember, cyclists are in a prolonged position on their bike, sitting forward in a flexion position, and that can cause a lot of mechanical strain on your disc, which again put pressure on the nerve, and that can give you nerve root pain down your leg. When you get nerve root pain, we would also recommend that you go to your physiotherapist. Your physio will do an in-depth evaluation to go and see where the compression is occurring, and they will go and treat that area. So they will release that nerve either along the nerve root or at the lumbar spine to help to get the pressure off the nerve. And there you have it. That is our 5 causes of lumbar pain in CrossFitters, in weightlifters and cyclists. Hope you found this very interesting. Please leave us a comment. We would love to hear back from you.